welcome back to Navigating the Periphery. My name is Deborah, and this is my son Philip.
Hello.
In creating this channel, we are trying to erase the stigma of mental health one show at a time. So if you're into what we're doing and what we talk about on our channel, please do all that YouTube stuff if you haven't already. If you could reach down and give this video a big thumbs up and a like. Honestly, this means so much to us as content creators, because the more likes we get, the more widely YouTube will distribute it on its platform. And we really want to get our message out there in order to help as many people as we can. So how's everyone doing this week? Philip, how are you?
I'm good. How about you?
I'm a little hoarse, but we'll get into that. In today's episode, we are going to talk about how the COVID-19 pandemic had a significant effect on mental health in the United States and worldwide. And an ironic bit of information for this week is that last week in our house, we all had COVID for the second time since 2020. So we're all getting better, but we're good now, so we're going to give it a go. So Philip, take it away.
Thank you. All right. This topic is very important to me because during the COVID-19 pandemic is when I was diagnosed with schizoaffective disorder. As we stated in our previous episode, if you didn't watch it, please do. It's available in the description. My doctors cannot pinpoint how my schizoaffective disorder broke through. Whether it was for my mom being so incredibly sick with COVID, or me actually having COVID myself.
The COVID-19 pandemic significantly affected mental health, not only in the United States, but worldwide. Incidences of mental health issues like anxiety, depression, and even suicide rose greatly during the pandemic. I believe one of the biggest factors, well, it's a proven factor actually, was the isolation people endured with all of the lockdowns across the country.
Also, fear of even catching the virus, financial stress, and disruptions to daily life contributed to increased levels of anxiety, depression, and other mental health challenges for many individuals. The lockdowns that were put in place, social distancing, and quarantines led to the increased isolation, reducing social interaction.
Lack of human connection can definitely contribute to feelings of loneliness and depression, even without an underlying mental health issue. At that time, the uncertainty surrounding the virus, its transmission, and the effectiveness of preventative measures caused heightened levels of fear and anxiety. Concerns about personal health, the health of our loved ones, and the economic impact of the pandemic definitely compounded the stress.
I agree with that, Mom. Basically, there was fear everywhere. Fear of contracting the virus, fear of spreading it to vulnerable populations and people you care about. This heightened stress nationwide. The pandemic resulted in significant loss, including loss of loved ones, job loss, and basically the loss of normalcy. The grief of those losses can also contribute significantly to mental health issues.
The closure of schools, workplaces, and recreational activities disrupted our daily life and routines. Routines provide a sense of stability and predictability, and any disruption of it can lead to stress and feelings of disorientation and extreme anxiety. Loss of one's job, economic downturns, and financial insecurity also contributed to stress and anxiety for so many individuals and their families. A huge problem during this time was media overload. Constant exposure to news and information about the pandemic through media channels led to information overload everywhere you looked. Whether it was on TV, on social media, the virus was there in your face 24/7.
Infection rates, death rates, and all of those type of statistics are stressful. Here are some reasons why constant exposure to pandemic-related news may have negative effects on your mental health. Media outlets often prioritize reporting on negative and sensational news, which can create a skewed perception of the overall situation.
Every day, the death toll from COVID was spoken about, that patients were dying at alarming rates, and in New York, where we live, that morgues and funeral homes ran out of room and deceased patients were being stored in refrigeration trucks in parking lots. This is horrifying news that no one should have to be exposed to. Continuous exposure to this type of distressing information can increase anxiety and depression. At the time, the sheer volume of information coming in and being reported on was overwhelming. This made it difficult to process all of the data that was coming in regarding the virus.
Constantly consuming pandemic-related news contributed to a sense of uncertainty and fear. Along with the isolation from the lockdowns was a dangerous combination for many people to endure. Then rapid changes in information, conflicting reports, expert opinions, and the evolving nature of the situation becoming even worse can create even more anxiety about what to believe or to expect. The pandemic was a national and global crisis that individuals felt they had very little control over, which is unhealthy for people who don't suffer from mental illness. Let's face it, being bombarded constantly is just not healthy for anyone.
With all of this chaos, the pandemic put a significant strain on our healthcare system, and access to mental health services were becoming very limited. This can hinder people from even trying to seek help or support, especially the ones who need it so desperately. Philip was diagnosed during the pandemic, and it was nearly impossible for me to find mental health professionals that were available or even accepting new patients.
I thank God that my mom worked in the medical field and knew how to deal with the healthcare issues and problems that were occurring at that time. She was able to start the process and get me seen by a psychiatrist because at that time I was already in psychosis. I was experiencing auditory hallucinations, loss of time, disorganized thinking, self-harm, and other positive symptoms of schizoaffective disorder.
As we shared in our last episode, positive symptoms are classified as hallucinations, perceptions that occur without any external stimuli, such as hearing voices or seeing things that others don't. Delusions, which are false beliefs that are resistant to reasoning or contrary evidence. This includes paranoid delusions or grandiose delusions. Then there's disorganized thinking, difficulty organizing thoughts, leading to incoherent speech or communication. Often called word salad, Philip experienced this symptom, which is a confused or unintelligible mixture of seemingly random words and phrases that make no sense, which can be very alarming for the person that you're trying to talk to or have a conversation with. Needless to say, Philip needed intervention for his symptoms and fast. I needed to jump on finding care before something really bad happened. Also during this, Philip didn't even realize that he was sick, so that was very scary as well. He was not aware that he was in psychosis. So there have been reports and studies suggesting a potential link between COVID-19 and an increased risk of mental health issues, including psychosis. While the majority of COVID-19 cases involves only respiratory symptoms, there have been cases where viruses have been associated with neurological and psychiatric complications.
Even though COVID is primarily a respiratory illness, it can affect the central nervous system. Some individuals with COVID have experienced neurological symptoms including confusion, delirium, and in rare cases, psychosis.
The virus can lead to an inflammatory response in the body, including the brain. Some of you may be wondering now, what is an inflammatory response?
An inflammatory response is a fundamental aspect of the body's immune system. It's a defense system that gets triggered when there's an infection or injury. The major goals of inflammation are to remove the initial source of tissue and cell damage, remove damaged cells, and initiate the healing process.
So, like I said, the virus can lead to an inflammatory response in the body, which can include the brain. Inflammation can contribute to neuropsychiatric symptoms, including psychosis, and individuals with a pre-existing mental condition or other vulnerabilities can be more susceptible to developing psychiatric symptoms during or after a COVID infection. The body's immune response to the virus may play a role in triggering psychiatric symptoms. The complex interplay between the immune system and the brain is an area of ongoing scientific research.
One specific topic discussed is called cytokine storm. You may have heard about this during news coverage during the pandemic. Also, in our last episode covering what schizoaffective is, I mentioned cytokines and their potential role in this process. And I said we would cover the topic in a future show, so here we go. Sometimes your immune system overreacts, releasing more cytokines than it should.
And there is emerging evidence suggesting a potential link between COVID-19 and the development of neuropsychiatric symptoms, including psychosis, in some patients. One hypothesis for this phenomenon involves the role of pro-inflammatory cytokines. During a COVID-19 infection, the immune system's response can include the release of pro-inflammatory cytokines as part of the body's effort to combat the virus. However, an excessive or dysregulated release of these cytokines, as seen in cytokine storm, can lead to systemic inflammation, which may have various effects on the body, including potential impacts on the brain.
Cytokines can promote inflammation within the brain itself, which may contribute to the development of neuropsychiatric symptoms. Inflammation can affect the levels and functioning of neurotransmitters such as dopamine and serotonin, which play key roles in mood regulation and perception. It's crucial to remember that knowledge about COVID-19's effects on brain function and mental health is still developing, despite mounting evidence and interest in these links. I had to study some research articles regarding this topic in college last semester. So for any of you interested, I have included the link to that research article below.
More research is definitely required to completely understand the mechanisms involved, the prevalence of psychotic symptoms, and the most effective approaches to therapy and care. Psychotic symptoms in the setting of COVID-19 are very uncommon. However, when coupled with a genetic component of mental illness, like the genetic factor that's in our family, and Philip's pre-existing obsessive-compulsive disorder and generalized anxiety disorder, this was a perfect storm for Philip's schizoaffective disorder to break through or come about.
Psychiatric symptoms associated with COVID are often treated using the same psychiatric interventions not involving COVID. However, the long-term impact and recovery process are still areas being investigated in the field of medicine. It's important to note that while there have been reports of COVID-19 related to psychosis, those cases are rare when compared to how many people have actually had COVID-19.
The prolonged nature of the pandemic has also led to something called pandemic fatigue, where individuals may feel emotionally drained and less motivated to adhere to preventative measures. It's important to note that the impact of the pandemic on mental health is varied among individuals and communities. Even with the uptick in cases right now. I mean, we were just infected last week. So right now, less people are getting vaccinated or boosted or wearing masks to protect themselves from illness.
I think we have become more lax, thinking, well, the worst is over, right? However, the impact of the COVID-19 pandemic on mental health is still persisting. Even today, even after the acute phase of the pandemic has passed, the pandemic has left a significant on individuals and communities, contributing to a range of mental health challenges.
Seeking professional help, maintaining social connections, and practicing self-care is essential for coping with mental health challenges that have been associated with the COVID-19 pandemic. But again, sometimes that's easier said than done. Many people don't know where to get help, how to go about it, or where to find it.
How do you guys feel about the COVID-19 pandemic? Did it affect you? Do you feel it has had a negative effect on mental health? The healthcare system. Have you found it hard to find a doctor to help you? Please let us know. Share your stories. And if you need guidance of where to look in the medical community, we can help. We've been through it.
We've also included below 3 online therapy sites that you may find useful if you really need to talk to a professional but are having difficulty obtaining one to actually go to an office and visit. So, Philip, that was a lot of information, and a lot of the material you researched for today's episode was really fascinating. How do you think it went?
I think it went pretty well. How about you, Mom?
I think it went well. How do you think, what are your personal feelings on your schizoaffective diagnosis and COVID? Do you think there was a link?
I think so.
I definitely think so. But we'll never know, unfortunately. If our content has impacted or benefited you, please consider forwarding it to others who might find it useful or helpful. Maintain contact and stay connected. Any questions or comments are always welcome. We appreciate you watching this video and taking part in our journey.
Remember, it's okay not to be or feel okay all the time. Remember, you're not alone.
Also remember, the concept of what is normal in our society is subjective. Embracing our differences is what makes the world a more diverse and better place. Try to remain optimistic and keep strong. And never forget, you are not doing this alone. Join us in attempting to stop the stigma of mental health issues one show at a time. Thank you so much for joining us. Below is a link to that article, that research article that Philip had to look up for school. I am Deborah, and this is my son Philip. Take care, have a great night, and we'll see you next week with a new episode. Also, the 3 online therapy sites below are betterhelp.com, talkspace.com, and brightside.com. I hope you find the therapy you need, and remember, you're not alone. Thank you so much for joining us. Philip, thank you for joining me in doing this.
Thank you.
Have a great night, and we'll see you next time. Bye.
Bye.